Well, I think ICS has done, over the past few years, a tremendous job of working not only just in South Carolina, but in other states and at the national level in helping raise the conversation around children and the benefits to children of really looking at aggregated investments and improving their lives and the lives of their moms, their dads, and the communities in which they reside.
I've had the pleasure in the years that I've worked in early childhood to work with a number of people on the ICS staff, and I have to say it's always a pleasure, and they do good work, they work hard, they're in it for the right reason, and I just can look forward to our continued partnership to improve outcomes for low-income kids.
ICS's systems level, policy level work is some of the most inspiring pieces of work that we have seen within this region, within this area. The research briefs that they create really do inform us in what is going on to better understand the data behind some of the outcomes that we're seeing. And it guides our investment.
I think of ICS as being at the forefront of the innovation in social services. There is kind of so much going on in the early childhood world, lots of evidence-based practices that service providers are thinking hard about how to implement and implement well in their community. I think of ICS as a thought leader and as a supporter of those initiatives.
And particularly, as a First Steps director, the reauthorization and reform of First Steps, which happened over the last 5 years, really happened as a result of the policy work that ICS has done. We wouldn't be here today at First Steps if ICS hadn't taken the lead on bringing some new accountability language to help reform and reauthorize First Steps. And having a partner that works alongside you makes my work better, it makes what we invest in better, and it really makes us just a more effective community in addressing early childhood needs.
I think it's comforting for all of us that want to improve, address the challenges in our communities, to know that there's a leading edge think tank based in South Carolina, but pushing for world-class strategies to move things forward for children. And that matters to every parent and every would-be parent in South Carolina.
So that's kind of how I would describe it to one of our moms. They may not ever meet ICS, I hope they do, but if nothing else, they knew that there was somebody out there that was really advocating for the resources to be available so that more families could benefit from a program like Nurse Family Partnership.
They're looked at as an expert in the State House, and I will tell you that in their short life, they have been one of the most progressive and aggressive organizations in getting us to think about social innovation, what we're doing for child and family outcomes, encouraging the other stakeholders in the space of children advocacy and work to come together and collaborate.
Just like any nonprofit group, it's where us legislators, where we rely on is on the information that we receive. We're expected to be masters of everything, but we're not. And I at least rely on other government agencies and also nonprofits to let us know what is actually going on, and ICS does that for our early childhood learning.
I would say ICS is an organization that is really trying to allow families and children to have the most sustainable, successful outcome possible, and to be that voice when sometimes they feel they're not being heard.
They have been an integral part of education at the State House for a very long time, and we reach out to them so often, especially in the research area, because ICS does a wonderful job of keeping up across the United States the best outcomes, research-based and all education, especially for younger children. And we've been very vested realizing how important it is to give our young 0 to 5 a good start and have them ready for school. So ICS has played an integral part in all of that.
ICS is a great partner to go to if you have questions around policy or research. You know that it will be credible and relevant in terms of the field of early childhood, and it really helps inform decisions that funders need to make and others need to make in terms of what are those strategies that need to be put into place to ensure that every child is successful.
So we're really about the research, I think, that has been enormously helpful, is really focusing on those early influences, the adverse childhood experiences, better understanding the impact of poverty, of the social determinants of health, and that in turn then allows us to expand some of the programs that already were in place, like nurse-family partnership, and then to really bring better practice into our clinical settings, screening for developmental problems and for their social determinants, and then being able to back that up with the evidence, and then to strengthen and reinforce our efforts towards advocacy and policy, especially policies that would have an impact on children and families.
There are ways that we work in our communities that create small-scale change, but policy is a very large-scale change. I mean, and policy takes a long time, as it should, because it is large-scale. But to be able to look to the Institute to see what policies might support or even not support the work that they're doing in the community.
There are also days when we are attending one of the many information and training sessions that they offer, and we have an opportunity to engage and work with them.
The Institute for Child Success is a group of people that are passionate and concerned about children, and they recognize that what kids really benefit from is not just sort of good intentions, but research, understanding, having actual expertise that can be applied to young people's lives.
It brings together a lot of the players that are associated with early childhood, but even bigger than that. Whether you're talking to a group of physicians who deal with family medicine or pediatrics or neurology or whatever the specialty may be, it gives me the opportunity to have conversation and dialogue with a number of people that I would not come in contact with on a daily basis.
Number one is we are a collection of incredible individuals. Our young staff will go to the nth degree to find the answers, to create the answers, to do the research, to disseminate the research, to get up to DC, to get to Columbia, and to get our work done. Without them, we would not exist. We provide direct service to the organizations, entities, and individuals who are responsible for that work. Our goal is to get the information they need in their hands. Our goal is to help us all learn to collaboratively do the work together so as to create an integrated system of services for young children and their families in Greenville and in our state.